Good evening, everyone. My name is Brenda Ahlberg, Kenai Peninsula Borough Information Officer. And tonight we have a special guest with us. Her name is Leslie Phelps. She's with our Public Health Department, part of the Department of Health and Social Services here on the Kenai Peninsula. And we're glad to have her tonight. She's going to help us address several questions. And before we do that, I also want to welcome our Incident Commander, Dan Nelson, with an update, as well as lots of other things that have been happening today. And I'll let you take it over, Dan.
Thanks so much, everybody, and thanks for joining us this evening. So I'm going to be real brief with my update so we have enough time to get into questions. And once again, Leslie, thank you so much for joining us tonight. I know many folks have got a lot of good public health questions, so we're glad to have your expertise. From Incident Command standpoint, we did a lot of work today in working on some supply chain issues and looking at equipment and personal protective equipment for our healthcare and responders. Made some progress on that and working through those issues. Some forward planning as it related to recovery and continued response as we see differences in what the health community is telling us and kind of different updates as we're getting them and more updated guidance. For folks on the peninsula and talking specifically about Kenai Peninsula cases, we did not announce any new confirmed cases today. However, there were some additional cases in other parts of the state, as well as one fatality in Anchorage that was released. So a quick update there. And then, of course, as many of you might have heard by now, the governor had a press event earlier here about an hour ago and announced 2 new health mandates, but we'll answer some questions about those, but essentially those mandates compel all residents to stay inside, maintain social distancing, and stay inside their home unless you work on essential business. And there's a specific list of those folks that also prohibits travel in between communities. So this is something, it's a real serious thing. We've been talking about it a lot in these evenings. And I think this is a sign of just how important it is for the governor to come out and mandate us all to do that. So that is effective at 8 a.m. tomorrow. All residents, including all residents of the Kenai Peninsula Borough within cities or out of cities, are compelled to stay in their home unless they are essential employees. So that is a real brief update. I don't want to take too much of our time this morning, especially with this evening, especially with our guests. So I'll hand it back to Brenda for maybe some questions, or we'll go from there.
Just want to remind our audience tonight that we will be monitoring the comment thread for additional questions. We'll pop back down to those after we've had our conversation with Leslie, and also those questions that we cannot address per agencies, we'll certainly try to get the answers for you. Miss Leslie, we spoke a little bit today about lots of things out there that we could potentially talk about, and I like the fact that you summarized it very well with regards of how important it is to stay inside. And from that perspective, can you provide us a summary of why it's so important and what it does to help ensure that potential strain on our healthcare facilities?
Sure, Brenda, and thank you. And good evening, everybody. Thank you so much for listening in. My name is Leslie Phelps. I'm the nurse manager for Kenai Peninsula Public Health Nursing. We cover Seward, Homer, Central Peninsula, Hope, and Tyonek, and we're real happy to be here tonight. Just to fill you in a little bit, at this time of this worldwide COVID-19 pandemic, public health nurses want to stress the importance of social distancing, wiping surfaces down, covering your cough, staying home when you're sick, and washing your hands. I'm going to start by saying a large role for public health nurses here in Alaska is case investigation interviews and monitoring all cases and contacts for 14 days or until they are discontinuation guidelines. A case is a person with laboratory confirmed COVID-19, and contacts will be anyone that a close contact has encountered that is less than 6 feet for more than 10 minutes in the last 14 days. Public health nurses are reaching out to more and more people every day in an attempt to find contacts and assist with isolating or quarantining those folks to prevent the spread of COVID-19. Additionally, we are working in our communities. We're planning regarding resource availability. We're trying to flatten the curve. I'm sure you've all heard that terminology. I'm happy to explain it if someone doesn't understand. to give us time to ramp up our health system's availability to care for ill persons. That's why it's so critical at this time to practice physical distancing, don't touch your face, and just don't share germs with anyone. We want to keep people out of the hospital in the first place. We know this illness has extreme effects on our elderly population, and what we're also finding out is that it can severely affect our younger population. We want to keep our healthcare providers healthy so that we can do our jobs. So to our younger population, I ask that you also follow the physical distancing as well, because even if you have mild symptoms, we still don't know exactly how you can spread the disease, and we don't want anyone to become ill. We don't want anybody to have to leave work. We don't want to have anybody go to the hospital, or we don't want to have anybody die. It's the transmission that we are concerned about. So Dr. Anna Zink is our State Medical Director, and her along with Governor Dunleavy have press conferences in the evening. I would encourage you all to listen in on those if you haven't been. They're very informative, and the governor then updates all of us on his mandates. I am going to go ahead and address some of the questions that Brenda already supplied me with from the audience, and then we can probably have time for you to ask more questions. So Brenda, I think I'll go ahead and be able to address what you started out with. One of the questions that somebody asked, and this is a good one, how does CDC report cases by residency and why? And so what we are doing now, cases are listed by residence, and they're also listed by presumed exposure source, which includes travel-related, non-travel-related, close contact, or pending. You've heard all of those in those press conferences. What this does is keep the data and the counts consistent for CDC, for your public health nurses, and for people at state epidemiology. So as we refer to cases and continue our investigations and monitoring, we have some consistency. So thank you for that question. Somebody also asked, and this is a great question, what is the difference between a swab kit and a test kit? So what you might call a swab kit is the medically correct swab, which is not a Q-tip, the vial with the transport medium, and the shipping materials to get that specimen to the appropriate laboratory. The swab kit also includes the PPE equipment used by the healthcare worker to perform the test, which includes a face mask, eye protection, gown, and gloves. So this is one of the many areas where we use PPE and why you hear concerns about PPE shortages. It's mandatory for health professionals to use PPE when they're administering the tests. The testing kits, these are the actual kits that are used at the laboratory to do the actual test. So we have laboratories in Anchorage and in Fairbanks in the state of Alaska, and then there are also out-of-state private laboratories that are being used for COVID-19. Among other supplies, the test kit itself at the laboratory requires a reagent, and it also requires ample healthcare and healthy healthcare professionals to administer the test. So that was a great question. I hope that clarifies that a little bit. Another question Brenda supplied me with was, how many tests on the Kenai Peninsula Borough have been negative versus pending results? So this is a hard question to answer borough-wide, because we have 3 hospitals sending tests to the Alaska State Public Health Laboratories in Anchorage and Fairbanks. Then we also have private providers who are testing and sending samples to private labs down in the lower 48. I think Brenda is planning on hosting hospitals on another live broadcast here on KPB Alert to answer hospital-specific questions, so I'm not going to address that. What I can say is if you go to the State of Alaska website, the EPI website, that's www.epi.alaska.gov, or you can Google Alaska Epidemiology or Alaska EPI, and proceed to the COVID-19 page. On that page, if you scroll down to a gray box, you'll see confirmed cases in Alaska, and that will give you counts in Alaska and then also national and global numbers. And if you scroll down a little more, you'll get to information about tests for Alaska residents. I think you'll find that information quite interesting. The last time I looked this afternoon, commercial labs had completed 1,163 tests, the state had completed 1,225 tests. And we all know that at this time there's, we all know, and I've forgotten the number, we're at, Brenda, do you remember the number, 75, 80 cases as of today?
I'd have to pull the mandate to make sure that I'm correct, and we'll provide that in the feed as well.
Yeah.
One thing I want to add with what you're saying regarding testing is the fact that it takes a bit of time to get those tests back. And can you expound on why it's taking so long to get those tests back?
So what I've heard from the Alaska laboratories is they're getting those turned around fairly quickly, anywhere between 1 and 3 days. Again, they have to run the tests, they have to have the personnel to run the tests. You know, this is all new ground for all of us. We're ramping up our medical capabilities, and I know that there has been some issues with the reagent. As far as the lower 48 and why it's taking so long for the private labs, I don't have an answer for that. Maybe that'll be a good question to save for when we have the hospitals on this live feed to get a little more specifics about those testing. So that's a great question.
We'll certainly put that one down for another time. And thank you for the fact that if we don't know the answer, we're not going to try to make something up. Thank you for that.
Yeah. I'll just keep going. These are some more of the questions, Brenda, that you supplied me with, and then maybe we can expound on them. Are we showing so few cases because there's no testing available? I thought this was a great question. So what I know is South Peninsula Hospital, Central Peninsula Hospital, and Seward Providence do have test kits. Also, private providers have test kits. Remember that a test kit also includes the PPE the healthcare professional needs to don to get that sample. But yes, testing worldwide is limited due to supplies and resources. There is no doubt that more testing would be beneficial. That said, CDC and the state of Alaska have patient criteria based on 3 priority levels. The goal is to test those whose medical care would be different if they tested positive. For those who have symptoms that can be managed at home, isolation at home until discontinuation is the needed medical care. For others, they may need to be admitted to the hospital. So at this time, testing for those who are asymptomatic is not recommended. Viral load could be too low to detect anyway at this time.
So I wanted to stop. I wanted to interrupt you just for a second and come back to the importance of that. If someone has particularly other types of respiratory illness symptoms, then obviously they're going to be tested to eliminate those before having a COVID-19 test. Is that correct?
Right. So of the 3 priority levels, this may help clarify that. It's for people who are hospitalized, the highest priority level, that live in long-term care, healthcare workers or first responders, known close contacts to confirmed cases within the past 14 days. And different than CDC guidelines, Alaska also added to the high-risk priority level travel in the past 14 days to a location where community transmission is occurring. As of yesterday, quite a large percentage of the cases in Alaska were travel-related, so we're keeping a particular finger on that pulse. And then there's also the medium and low priority levels that we can talk about. So does that answer your question, Brenda, or do I need to talk about something else?
No, it does, because one of the things that's been brought up to us several times is how can I get a test? Is there going to be a test available for everyone? And so it really clearly defines that that's not realistic to assume, nor is it something that is being proactive and being able to address potentially underlying measures that are not COVID related. So I appreciate the clarification. I think our audience will certainly appreciate that as well.
Yeah, if it's helpful, I'm just going to read this. For medium priority level, that's outpatient who is at increased risk for serious illness, that is age greater than 60 years or has one of the more chronic medical conditions such as heart disease, lung disease, diabetes, and immunocompromised. So the high priority folks would get their tests done within the state of Alaska at one of the 2 state labs. The medium priority patients would, test results would be, or test specimens would be sent to the commercial laboratory. And then the low priority level is any other patient as determined by clinical discretion, and those again would be sent to the commercial laboratory. So is that even more helpful perhaps?
I think so. I think that's good to have that clarification.
Right.
Moving down some of the questions that we also provided to you today had to do with how many respirators are here on the peninsula and what are some of the alternative hospital accommodations that might be being set up.
So again, what we're looking at is we're trying to flatten that curve. I think that, again, Brenda, that'll be another great question to save for when you interview the hospitals as far as what equipment that they have. And we also know that the state of Alaska will have other resources to pull from. The state or the National Strategic Stockpile would be one example of where other supplies could be requested from. But we don't want to get there. We want to flatten that curve. We want social distancing to be going on, hand washing, not going to work when you're sick. We want to stop this before it gets into the state of Alaska. And I would have to say, from what I've seen in the communities and listening in on meetings statewide, it seems like Alaska's got a pretty good jump on doing this social distancing and keeping the incidence of the illness way down. So we want to prevent hospitalizations from the start. I think that's what we really need to focus on.
Very good point, and I couldn't agree more that that is being proactive, and that is something that is going to require all of us to do so.
So there was additional questions. Will there be drive-up testing on the Kenai Peninsula Borough? And I think it would be helpful for folks to know that the hospitals, the city leaders, borough, and state officials are currently compiling a detailed list of testing sites that are available and working to determine the best way to test the people that are at the highest risk. Again, it will depend on keeping our healthcare workers healthy, and then of course obtaining test resources. So again, if you've got any kind of cough or temperature or illness, the social distancing is what's going to keep all of us healthy. You may be around someone that you don't know that is a nurse or a doctor or health professional that you're spreading the disease to. So we really want to focus on preventing the illness. Currently, the University of Alaska is providing the governor and state epidemiologists with modeling that's based on world, national, other state, and Alaska data. And this modeling will help us kind of extrapolate what could be coming our way and helping the governor and everyone make decisions on how to proceed next.
And I just want to add to that, with that modeling, that helps support planning from a perspective of whether it's mass care or how we are going to utilize the resources we have. I want to bounce back to Dan for a moment and talk to him about what we have been doing here on the peninsula. He'd been talking about planning, and there's now, we've come to fruition. Can you explain how that is going to benefit us now?
And that planning process and really that collaboration process has been so important and really setting the stage for this. And when we talk about mass care in an emergency management complex context, we typically talk about how do we take care of people in an emergency? And we're usually thinking about things like fires and floods and winter storms and those types of things where we might provide some of those types of services. So what we've been talking about is, will we have a need for that kind of service? We have definitely some special populations out there that have differing needs. And so whether we have access and functional needs, whether it might be homeless population, any of those types of categories, there is some special considerations that need to go into that process. Same thing for those that are, maybe may live in some sort of congregate care setting, when we have assisted living facilities and some of those, and how that might impact if we have different things that come up through this virus and through our events. So we've been looking at some contingency plans for that, as how we do that with that social distancing and with that care. And that's really gone through cooperation with public health and with all of those, all of the facilities and cities that are in on these collaborative sessions. At the same time, we do continue to plan for our more traditional things, and I'll share. Some folks may have noticed the large earthquake a few nights ago out near Russia, which actually had us quite concerned for an hour or so, based on some potential tsunami risk and what would happen if we had to move people to high ground in the cities and the coastal areas while still maintaining that social distancing. So planning has really revolved around both of those facets. And and I'll be real honest with folks. It's pretty uncharted territory. We don't generally think about pandemics as something that we plan for or has the most likely scenario. So mass care is looking a little bit different in this type of event. However, I'm confident that we're going to get to those solutions and continue that process. So it's one of those things. It's difficult to talk about something besides just planning, but looking at contingencies is really, I think, the better way. And how do we modify the playbook that we have to fit this scenario? And it is a challenge.
And in this time frame, we are taking advantage to be prepared in the event of a spike. And that's something that I want to celebrate with the team, as well as our cooperators that have been meeting every single morning, as well as additional side meetings to ensure that the resources have been evaluated and that those contingency plans are in place, so that in the event they have to be activated, we can know that we have done a good job of preparing for that, whatever it may be. Ms. Leslie, coming back to some of the questions that were asked, some of them included the vaccination efforts. Can you speak a little bit to that, please? And I'm sorry, I touched my face.
Yeah, I know that's a hard one. It's really difficult to do that or to not do that. Yeah, sure. So thanks. Vaccine and the malaria drug, chloroquine. There was some questions on that. Great questions again. I'll just talk about chloroquine real briefly. There are no updates at this time of using that for COVID-19. There's a lot of private research companies and the FDA that are doing testing on drugs. Currently, chloroquine and malaria medications, they're being considered off-label use if folks are using those. As far as vaccine, there's no news that I've heard of, other than, again, a lot of folks are working on it. Private companies, universities, the NIH, National Institute of Health, which is the nation's medical research agency. One vaccine just introduced to clinical trials was developed because of prior studies related to the coronaviruses that caused severe acute respiratory syndrome, that's SARS, and Middle East respiratory syndrome, that was MERS. With these clinical trials, they will monitor for common vaccine symptoms and then take blood samples to review what the immune response is over time. So that's what we know for now.
All right, we have some questions that are coming into the comment threads, and some of them I don't know that you'll be able to answer. If you can't, just please say, nope, can't answer that question. But one of them is, if there's a family member is sick, should they be taking Tylenol over ibuprofen? And that is something that leans right into some of the social media comments that are out there regarding those NSAIDs.
So NSAIDs are nonsteroidal anti-inflammatory drugs, also known as aspirin, ibuprofen, naproxen, Celebrex. And I believe about avoiding NSAIDs with COVID-19 came out of France. Everything that we looked up today and checking with the state also about avoiding NSAIDs with COVID, we just haven't found anything that supports that. There just isn't enough data. There isn't enough research. So your best avenue here is to talk with your primary provider, who would be your prescriber anyway, to find out what they recommend you take. Good question.
Thank you for that. With regards to one of the questions that's here is a little bit more clarification being asked. Could you please explain why folks with comorbidities have a higher priority of getting tested? How would a positive test change their course of treatment?
So thank you for that. People that have comorbidities, their immune system is already weakened because their immune system is working on fighting that comorbidity or that disease. Additionally, if your comorbidity has something to do with your lung elasticity, your lungs just won't have the strength and to fight off the virus. The virus gets into the lungs, it replicates in the lungs, and then your immune system responds by sending a bunch of white blood cells to the lungs, and with all that action going on in the lungs, pretty soon they start filling up with fluid, and that's how most people die from this illness is because of the pneumonia that sets in. So those comorbidities are really important to have the people get tested, and then their treatment, of course, wouldn't be just isolating at home. Not that isolating at home is an easy thing when you're not feeling well either. This disease is pretty serious, and you really don't feel good, but you wouldn't need to be put on a ventilator. So that's what's important for these people with comorbidities.
All right. Another question that has come up with regards to folks that are traveling, and with the mandate that came out tonight, both mandate 11 and 12, the restrictions that are in place. I'm going to bounce back to Dan as well. But for you, Leslie, just stopping that spread starts with us staying at home. And one of the questions that has come in tonight and a couple times is college students, as they are coming back home, what are some of the precautions that family members can be taking as they are coming home?
So again, if you're traveling from out of state, you're traveling through places where there's active disease, community spread, we're going to go ahead and have you self-quarantine for 14 days when you come into Alaska. If you have a family member that needs to quarantine, you're going to try to find a place where they can quarantine themselves. If they're not symptomatic yet, we're not as worried about them passing the disease on. You don't have to quarantine the whole family, and I know that it's not easy in household, but you're going to want to try to be able to stay at least 6 feet away from the quarantined family member. Additionally,
so we're still practicing, just to reiterate, we're still practicing that 6-foot distance even inside our homes.
Right, right. Another question along those lines that you brought up, Brenda, was if you'd self-quarantined in another state and then you came to Alaska, do you need to do another 14 days of quarantine? And absolutely, yes, you do. You will have been exposed to all sorts of travelers in other airports and on airplanes. We just can't be too careful. Just to try to squelch the spread of this, that's what we want to try to do.
All right. And Dan, if I could, I am going to come back from the mandate side of things. There's some confusion as far as we're supposed to stay inside. We're supposed to practice the 6-foot distance, but yet he's asking us or encouraging us to go outside and to ski and to go hiking. What's the difference here? What are we not doing, or what are we not recognizing?
And from the language of the mandate and the information that the governor and Department of Health and Social Services has put out for us, it definitely does on the surface look like a contradiction. So basically, again, it's all about flattening the curve. It's all about what we call the social distancing or the physical distancing. So, when we're outside and we're, of course, all of those things are being said that you can still do those if you're practicing that physical distancing, that at least 6 feet between people. Outdoor activities with that social distancing are still important to the health of Alaskans. They're still important to us as we're talking about being inside and kind of being cooped up. I was feeling a little cooped up today here in my office, and I actually went for a little walk as well. And those things are good things to do. It's the more of that congregation, those groups of 10 or more that people have been hearing about, the facilities like gyms and the movie theaters and all of those places that are kind of closed up and inside. So the governor has come out and basically given some guidance. And when we talk about that staying at home, there are still some allowances for grocery shopping, picking up prescriptions, some essential business like that. He wants that to happen inside your own community. So being a relatively short distance from your home. But there are some exceptions to that. And also specifically in that mandate were exceptions for using restaurant services that were a takeout or drive-through. So And that is designed for, again, being responsible on that, where you're not your whole family is not going to the grocery store, going to pick up things at the drive-through. So a little bit of a contradiction, but I think from my standpoint is looking at this is I think it's a good ground to manage risk. We need to go to that next step. We've been talking about potentially these types of mandates coming out. The governor has now done it effective at 8 a.m. tomorrow, but there is some allowance there for Alaskans that need to take care of critical business, that need to be able to go take a walk and get out. So hopefully that makes sense. I think it was a very good middle ground for the governor to say, and there's some very good guidance that I know we have posted, some frequently asked questions, and it's definitely a few pages to read, but it goes into a bit more detail.
One of the things that we're getting a lot of questions on, and I don't know that we can address it tonight, but I do want to let our audience know that we're going to certainly find out for you and get something posted, is Mandate 11 says that it'll be reevaluated on April 11th, and Mandate 12 says it's going to be reevaluated on April 21st. Can either one of you share any details to why the difference in the date, Leslie?
When I first read Mandate 11, it was something that I'd been wanting to say for a while. If you think about it, if all of us could maintain that social distancing or that physical distancing that we've been talking about for 2 weeks, for 14 days. 14 days is the longest incubation period known for this disease. Incubation goes from 2 to 14 days. So if we could all do that physical distancing for 14 days in the state of Alaska, we could almost eliminate the transmission of this disease, and we'd be done with it. So I think that's where the governor is going with this. I was glad to hear him say that. We will certainly, if we did this for the next 14 days, let's say we just knew that was going to happen. Next week, we're still going to get a lot of cases coming in, because whatever laboratory confirmed cases we get next week are from a week or two ago. And so we'll still see an increase in cases, and you might be saying, well, I don't need to social distance anymore. This isn't working. Well, it is working, because if we all do it for the next 2 weeks, we'll see an increase in cases next week, and then it'll start dropping off. And it'll just, all of us are just really looking forward to that time when the number of cases starts decreasing, and we'll know that we're on the backside of things. So I really liked it when he said that about 2 weeks for that mandate number 11.
Thanks for that clarification. Dan, to add to that.
Yes, please, here, and I agree. It's important that one of the hard things, and I've actually talked with some folks about this, when most of us were here for the Swan Lake fire last year, and we saw different things and different pieces of that, but it was relatively easy to see progress, or as we went forward and we started getting humidity and things started improving and all of that. And it's difficult to see progress when you're combating a virus, combating something we can't see, something that doesn't make us sick right away. So I think it's a great thing for our residents to think about some patience. I know everybody has been patient so far. I don't want to say that we're not, but this is going to be something that we're in for the long haul. And when we talk about those dates, I don't know if there was perhaps an error or something that had come up. I was just looking at the mandates while Leslie was talking. It looks like the web version has them both on April 11th as being reevaluated. Now, I know the municipality of Anchorage, I believe, had the April 14th date, and maybe that's where there's some confusion or there was an update, but it looks like the governor's intent for both of those may be on April 11th. So if there's another source out there, we can probably get that confirmed, I'm sure, and make sure that we're saying the right thing. But I just did a quick look at it while we were speaking.
Thank you. And the one thing to remind our audience is that all of the official updates or news releases are on our blog at kpboem.com. That includes the state's page, covidvirus.alaska.gov, that has just a wealth of knowledge. It's a dedicated page to the coronavirus here in Alaska. One question for you, Leslie, that's come up is, how is public health assisting our local hospitals and other providers to increase healthcare capacity on the Kenai Peninsula?
Great question. So public health nurses are the ones that we get the report of the laboratory confirmation of someone that has active disease. We're the ones then that call that case and determine who their contacts are. And then when we find those contacts, we call all of them and we interview where they've been, and we start monitoring them for 14 days or until they're discharged from being monitored. So the way we're helping, of course, is trying to minimize the number of new cases that occur. That's totally what we are all about. You know, COVID is spread via respiratory droplets, person to person. When a person talks or sings or coughs or sneezes, the droplets then travel away from the person before they drop. So, you know, we're also doing a lot of education, covering your cough, your sneeze, washing your hands, again, staying home when you're sick, and then that close contact thing. So if you're at least 6 feet away from someone, that's what's going to keep the illness from spreading. I hope that answers that question for you, Brenda.
It does, thank you. I'm going to ask you if you have any closing comments before I turn it back over to Dan.
Well, I guess one other question that I saw, somebody had said, well, why don't we just close down travel from Anchorage? And I think too, we're all still wanting to maintain things like grocery supplies and the mail that we get. So I think that it's an individual choice and an individual obligation to our community and to ourselves to do the individual social distancing so we can still allow some semblance of normality and still allow some commerce to happen in our communities. And then I think the last thing that I'd like to close with, one of the nurses today, she told me, if healthcare professionals are working to save your life, can you please stay home to save theirs? Thanks a lot.
Very well said. And thank you for taking the time tonight to visit with us and to share the wealth of knowledge you bring to this community, in addition to your dedication to our communities. Have a good night, Ms. Leslie. Thank you so much. And at this juncture, I'll turn it back to Dan for closing comments.
Thank you, Brenda, and Leslie. Thank you again so much for joining us and providing that health-related background and knowledge that you brought. I would just like to reinforce today the governor's orders. We didn't get too much of a chance to talk about the details. There's quite a bit of information, some frequently asked questions. Those are all posted on kpboem.com. And I'm just going to remind everybody at this time that 8 a.m. tomorrow morning, Saturday, you are asked to stay in your home except for essential errands and critical infrastructure if you are employed by a business that's deemed critical, and all of that information is also on our blog. To help spread that message for those that don't monitor us regularly or watch these feeds, we will be sending out an alert to cell phones via text and voice call, as well as to landline phones this evening here over the next hour. So you may receive an alert from us to remind everybody of that and help get the word out. So I know if there's questions, we'll be catching up hopefully in the comments if we can assist with that. And with that, I really encourage everybody to stay healthy, enjoy your weekend, but please enjoy it from a distance as we talk about. We'll be back here tomorrow night at 7 o'clock, and have a great night, everybody. Thank you for joining us.
Good night, everyone.